Good morning, Dr. Mona Hacker here, talking today about intermittent fasting. Buzzword we're hearing a lot about. We know that intermittent fasting can promote weight loss. We know that there's some research on that. But really, what is intermittent fasting? Intermittent fasting is when we have a diet where we're cycling between eating and fasting periods of time. And basically, we're switching in this diet from concentrating on what we're eating to concentrating on when are we eating it. And when you think about it, our ancestors did not eat 3 meals a day with snacks in between, so it makes sense that there might be some benefit to this type of eating pattern that we will see when we look at studies of how intermittent fasting affects us. Now, what's going on with intermittent fasting? During intermittent fasting and these fasting periods of time, our body is making this metabolic switch. So only are we restricting sort of our calories during the day because we're eating for less time, but we're also seeing this metabolic switch where instead of using glucose for energy, our body is going to our fat stores and going to our fatty acid stores, breaking them down and using the fat for our energy and also producing ketone bodies. Ketone bodies, you may have heard of ketones, ketogenesis, really important terms in lots of diets. Ketones and ketone bodies are super important chemicals in our body that are important in many different pathways. Ketone bodies are the major source of energy for our brain and also are basically a part of a lot of different pathways in all different sorts of cells, which might be why intermittent fasting is showing some benefits and some potential for benefits in other areas besides just what we would expect from weight loss. Of course, with weight loss, we expect our blood pressure to get better. We expect that this could help with diabetes and diabetes prevention and our blood sugar control. We know that weight loss can help with our cholesterol, but we're also seeing with intermittent fasting some preliminary data that it may have some help and potential help for things like Alzheimer's disease, for things like cancer, for a lot of other disease processes like atherosclerosis in our blood vessels, which lead to heart disease. So there's a lot of potential with this method of dieting. And so that's why I think it's really important if you're someone that's looking for a way to lose weight or your doctor told you you need to lose some weight, this might be one of many good options that you may want to consider.